After seeing just the trailer for Contagion when I was 11, I became convinced that I was going to be the start of the next bubonic plague if I didn't wash my hands at least 20 times a day. Little did I know that that was the beginning of my journey with obsessive compulsive disorder. Obsessive compulsive disorder, or OCD for short, is characterized by intrusive thoughts that are often of a taboo or violent nature, as well as compulsions that are used to diminish the discomfort that comes with these thoughts. OCD obsessions and compulsions often manifest in relation to worriness over cleanliness, purity, and safety. The worst of my OCD happened when I was 14. So in addition to worrying if I was fitting into high school, I was also worried that I was losing my sanity. I spent significant portions of my day washing my hands and body, as well as desperately trying to avoid any mention or reference to sex, violence, or drugs, which is fairly hard to do when all your peers are teenagers. Since social norms restricted the compulsions I could do at school, I turned to self-harm as a way to make up for my perceived failings of protecting myself from my obsessions. This spiraled out of control and culminated in a suicide attempt the summer after my freshman year. I wasn't seeing any progress in myself, and I was seriously doubting whether someone who had such violent intrusive thoughts even deserved to live anyway. Thankfully, I am still here. And a combination of a medication change and a stay in a psychiatric ward convinced me that I both deserve and want to keep living. While I was eventually able to get the support I needed, there were many bumps along the way. I had medication and therapy, but it wasn't enough to stop me from hating myself and blaming my OCD on personal faults of my own. Since I still struggle with these feelings, I am always on the lookout for new avenues of treatment. The burgeoning field of evolutionary psychology may just be the key to helping me and other patients accept and appreciate who they are. Evolutionary psychology focuses on the reasons behind our present traits and how they might have served our ancestors in the past. As it turns out, what we consider mental illnesses today may have been beneficial in primitive times. Take anxiety, for example. When our ancestors had to be on the lookout for predators and other threats, anxiety could have been a very useful deterrent against putting oneself in dangerous situations. While anxiety today is often debilitating, and at the very least distressing, such feelings could have helped keep our primitive ancestors alive. Modern schizophrenia, a disorder that causes a sufferer to misinterpret reality, is associated with lower rates of marriage and fertility. However, despite how harmful the disease may be, it has not been eradicated from the population. There's widespread evidence that those with schizophrenia have a low frequency of rheumatoid arthritis. While modern medicine is a much better alternative to schizophrenia, centuries ago, way before we knew about germs and viruses, schizophrenia may have protected people from diseases that affected thousands of their peers. My OCD, too, could have been selected for the advantages it gave to a group instead of an individual. If one member of a group was constantly worried about safety and cleanliness, it could have helped the group as a whole to avoid danger and promote cleaning behaviors. Everybody in a primitive group had OCD, it's likely that that group would not be very successful at surviving in a world filled with predators, violence, and danger around every corner. This explains the current 1.2% prevalence of OCD, which is higher than expected for a random mutation. These are all very promising ideas, but given the nebulous nature of our minds and the obscured history of the past, we do not know anything for certain currently. However, this does not mean that this information should be disregarded. Mental health care is still far behind what it should be. Just over 70 years ago, in the 1950s, lobotomies, a practice one psychiatrist described as putting in a brain needle and stirring the works, were still widely used to treat a variety of mental disorders. There are many procedures, for both our brains and the rest of our bodies, currently in practice that we will no doubt look back at in a couple decades and wonder what the hell we were ever thinking. In fact, just 2 years ago, we learned that most appendectomies may have been unnecessary and antibiotics would have worked just fine. Since so much of our brains are currently a mystery, mental health care needs to take advantage of every possible tool to aid patients in both treatment and acceptance. Evolutionary psychology has actually been widely ignored in the realm of clinical psychology. It is time that we bridge the gap between these two subjects to create more effective treatment plans. It has been shown countless times that therapy based on acceptance and commitment is an effective treatment against many mental illnesses. We need to combine evolutionary psychology and traditional mental health care to create treatments that emphasize having sympathy towards oneself and fully understanding both the history and the implications of one's condition. Do I think that knowing about evolutionary psychology when I was 14 would have prevented my suicide attempt? Probably not. Would have greatly helped me to feel less alone if I knew that my OCD was not a defect of my own, it was rather something that could have made the difference between life and death for my ancestors? Absolutely. I have made peace that I will likely never be rid of my OCD. On the days when it feels like a house guest that is far overstayed their welcome, I can accept and appreciate that it may have helped my ancestors survive, and therefore also have helped me to be where and who I am today. If you want to know more about yourself and your ancestors, talk to your therapist or doctor about evolutionary psychology. It may just be the key to unlocking the door to acceptance.